Welcome. In this video, we'll be exploring X-linked retinoschisis, a genetic eye disease that primarily affects males. We'll delve into its causes, symptoms, diagnosis, treatment, and what the future holds for those living with this condition. X-linked retinoschisis, as the name suggests, is an inherited condition linked to the X chromosome. This means that males, who have only one X chromosome, are more likely to be affected. The culprit is a mutation in the RS1 gene. This gene provides instructions for making retinoschisin, a protein crucial for the structure and function of the retina. So, what exactly does retinoschisin do, and what happens when it's not working properly? Retinoschisin acts like a cellular glue within the retina. It's essential for cell-to-cell adhesion and maintaining the structural integrity of the retina's layers. When the RS1 gene is mutated, the faulty retinoschisin protein leads to a splitting or separation of the retinal layers, a process known as retinoschisis. This splitting commonly occurs in the macula, the central part of the retina responsible for sharp, detailed vision. X-linked retinoschisis is relatively rare, but it's the most common cause of juvenile macular degeneration in males. Its prevalence is estimated to be around 1 in 5,000 to 25,000 males. Because it's X-linked, females can be carriers of the mutated gene, meaning they usually don't show symptoms but can pass the gene on to their children. The signs and symptoms of X-linked retinoschisis typically appear in early childhood, often between the ages of 5 and 10. The most common symptom is decreased central vision or difficulty seeing fine details. Other symptoms may include nystagmus, or involuntary eye movements, and strabismus, commonly known as crossed eyes. Some individuals may also experience floaters or visual field defects. In severe cases, retinal detachment and bleeding within the eye can occur. Diagnosing X-linked retinoschisis involves a comprehensive eye exam. Doctors will assess visual acuity, examine the retina with an ophthalmoscope, and may use optical coherence tomography, or OCT, to visualize the layers of the retina and identify the characteristic schisis cavities. Genetic testing can confirm the diagnosis by identifying mutations in the RS1 gene. Electroretinography, or ERG, which measures the electrical activity of the retina, can also be helpful in making the diagnosis. While there aren't distinct types of linked retinoschisis, the severity of the condition can vary significantly from person to person. Some individuals may have relatively mild vision loss, while others experience more significant visual impairment. Currently, there is no cure for X-linked retinoschisis. Treatment focuses on managing the symptoms and preventing complications. Corrective lenses or low vision aids can help improve visual acuity. In cases of retinal detachment or bleeding, surgery or laser treatment may be necessary. There's also ongoing research into gene therapy as a potential future treatment option, aiming to deliver a functional copy of the RS1 gene to the retina. Since X-linked retinoschisis is a genetic condition, there is no way to prevent it from occurring. However, genetic counseling can help families understand the risk of inheriting the condition and make informed decisions about family planning. The prognosis for individuals with X-linked retinoschisis varies. While vision often stabilizes after adolescence, visual acuity generally remains below normal. Regular eye exams are essential to monitor the condition and manage any complications. Excitingly, researchers are actively exploring gene therapy and other innovative approaches to treat X-linked retinoschisis. These advancements offer hope for improved visual outcomes and a better quality of life for those affected by this condition.